What is the ANS role in chronic fatigue, orthostatic intolerance? Have you ever wondered how our bodies manage to stand up without feeling dizzy or faint? This process involves the autonomic nervous system, or ANS, which plays a crucial role in regulating our cardiovascular responses. When we stand up, the ANS helps control heart rate, blood vessel constriction, and blood pressure to ensure that our brain receives enough blood flow. However, in individuals with chronic fatigue syndrome, also known as myalgic encephalomyelitis or ME/CFS, the ANS does not function properly, leading to a condition called orthostatic intolerance. Orthostatic intolerance, or OI, is when the body struggles to regulate blood pressure and blood flow to the brain upon standing. This can cause symptoms like dizziness, lightheadedness, fatigue, and cognitive difficulties. Research shows that OI is very common in people with ME/CFS, affecting between 50 and over 80% of individuals. It is considered a key feature of this illness. In patients with ME/CFS, the ANS abnormalities hinder the normal cardiovascular adjustments needed when standing upright. This can result in insufficient blood flow to the brain, leading to the symptoms associated with OI. Some individuals may experience abnormal heart rate and blood pressure responses, but interestingly, studies suggest that postural tachycardia, which is an excessive increase in heart rate upon standing, and orthostatic symptoms can occur separately. This indicates that the involvement of the ANS in ME/CFS is complex and not just about heart rate changes. It is important to note that the dysfunction of the ANS in ME/CFS-related OI is not simply due to physical deconditioning, which is the loss of fitness. Research indicates that even well-conditioned individuals with ME/CFS show abnormal declines in blood flow to the brain during orthostatic stress. This suggests that the issue lies within the autonomic regulation itself rather than being a secondary effect of inactivity. Clinically, doctors can assess orthostatic intolerance in ME/CFS patients using tests like the tilt table test or the NASA 10-minute lean test. These tests evaluate how well the ANS maintains blood pressure and blood flow to the brain when a person is upright. Some patients may even experience symptoms while lying down, which points to a more widespread issue with autonomic regulation. In summary, the autonomic nervous system plays a critical role in chronic fatigue syndrome by failing to properly manage cardiovascular and cerebrovascular responses when standing. This leads to reduced blood flow to the brain and symptoms such as dizziness, fatigue, and cognitive impairment. Understanding the dysfunction of the ANS helps explain the disabling symptoms experienced by many individuals with ME/CFS and can guide appropriate clinical evaluation and management. If you or someone you know is experiencing these symptoms, it is important to consult a healthcare professional for personalized advice and support.